Why does the immune system attack eyes and TED? Imagine your immune system as a vigilant protector, but in thyroid eye disease, it gets confused and starts attacking the tissues around your eyes. This autoimmune disorder is closely linked to thyroid problems, especially Graves' disease, where the immune system mistakenly targets the thyroid gland. But in thyroid eye disease, the immune attack extends beyond the thyroid to the tissues behind the eyes, causing swelling, bulging, and redness. The reason this happens involves special cells called orbital fibroblasts, which are found in the tissues around the eyes. These fibroblasts normally help maintain the structure of the eye socket, but in thyroid eye disease, they start to act differently. They have receptors on their surface known as thyroid-stimulating hormone receptors and insulin-like growth factor 1 receptors. These receptors are usually involved in normal hormone regulation, but in thyroid eye disease, the immune system produces autoantibodies called thyroid-stimulating immunoglobulins that mistakenly target these receptors. When these autoantibodies bind to the receptors on orbital fibroblasts, they trigger an inflammatory response. This causes the fibroblasts to release chemicals that lead to swelling and tissue expansion in the eye socket. The fibroblasts also multiply and change into fat cells or myofibroblasts, which can cause tissue remodeling and fibrosis, making the eyes appear bulging or protruding. The immune response involves both innate and adaptive immunity, meaning the body's immediate defenses and long-term immune cells work together to amplify the attack. Immune cells like lymphocytes releases cytokines, which are chemical messengers that promote inflammation and tissue damage. This ongoing immune activity results in symptoms like redness, swelling, eye bulging, and sometimes even vision problems. Interestingly, although thyroid eye disease is linked to Graves' disease, it can occur even if thyroid hormone levels are normal or low. This shows that the eye condition is a semi-independent autoimmune process, not just a consequence of thyroid hormone imbalance. That's why simply controlling thyroid hormone levels often doesn't fully resolve the eye symptoms. In essence, the immune system attacks the eyes in thyroid eye disease because the orbital fibroblasts express receptors that the immune system mistakenly targets with autoantibodies. This triggers a cascade of inflammation, tissue swelling, and remodeling that leads to the characteristic eye bulging and redness. Understanding this process helps doctors develop treatments aimed at reducing inflammation and immune activity in the orbit, which is crucial for preventing long-term damage and preserving vision. If you suspect you have thyroid eye disease, it's important to consult a healthcare professional for proper diagnosis and personalized management.